everyone. Hello, Conversationally family. Deborah and I are here today with our first guest for this month. We're doing a series, as we said, on compression therapy, and we decided we're going to interview garment fitters that we are familiar with, who can give you some more information on that process and compression garments and everything you need to know about that arena, so you can get the best fit and the best garments for you, ideally. And today, our very first guest is a wonderful fitter that I've worked with in the city many times, in Toronto, where we live. Her name is Maria Wood. She works in the west end of the GTA in the Brampton, Mississauga regions at Adapt Home Healthcare. She's awesome. She also used to do mobile visits, a little slowed down by COVID, but she showed up for me in times when it's been really tight for clients, and I so appreciate her for that. She also has 10 years of experience, is super knowledgeable, and is really caring about her patients, and that she wants them to be educated about the garments they're wearing and as far as proper use and what they're doing for their body, so they will, of course, wear them more consistently and do really well with their lymphedema. Maria, welcome.
Thank you, Bisa. I'm so happy to be here.
We're so glad to have you. All right, Deborah is going to take it away with the first question.
Right. So we would love if you could give us a basic rundown, actually, of the difference between an inelastic compression garment, flat knit versus circular knit elastic compression, and which type is the best for patients based on the stage and the presentation rather of their symptoms. What would be that basic rundown to start off with?
Sure. Well, the state of their lymphedema really impacts the garment choice. So depending on the stage they're at, if it's low, like a 0, you could wear a circular knit. I'd put a circular knit on someone who doesn't have very much swelling. Maybe they are through hereditary, they might be getting swelling depending on where it is. Circular knit's great. It doesn't contain a lot of swelling. It does stretch out because it's elastic. So you want something a little firmer if you do have a lot of swelling. So maybe like stage 1, stage 2, as you go up, you would want something a little firmer. A flat knit is very strong. You can do it in any kind of 20 to 30, 30 to 40, 15 to 20. You could even do it low like that, depending on their swelling. So I would put someone in a flat knit garment who has controlled their swelling and also needs the containment. So the other one, the inelastic garments, they are made usually with the Velcro closures, and they're good for reducing. So someone might want to start off with an inelastic garment to reduce and then go into a flat knit garment as they've gone down to probably the smallest size that they can.
So what are the various classes or pressure ranges of the garments, and how do fitters decide? Again, I think you got into that a little bit in your last question, what is needed for a given lymphedema patient when they show up in the office?
Sure. Different stages of lymphedema for different garment strengths. So what we usually do is, as a fitter, we will work hand in hand with one of the therapists or clinicians just to get some feedback, because they'll know a lot of the history of the patient. So basically, if it's arms, they'll probably do on average a 20 to 30. Something like head and neck lymphedema, it's going to be lower. I find that head and neck, they'll have the garment itself is very light, and I guess because this area is very sensitive, it responds really good to compression. So they don't need anything high compression there. Depending on the patient being diabetic, you don't want them in anything too high either, or you'd want someone with bigger swelling, the lobules, in a higher compression. Most people can tolerate 20 to 30, depending on maybe their age, how their skin is. If their skin is really fragile, you don't want anything too rigid for them.
I know that people often use 15 to 20, which is very mild, 20 to 30. I know the 30, 40 and the 40 to 50 exist. Have you ever used anything higher than a 20 to 30? Because it seems very uncommon. In what context would that happen in?
Yeah, 30 to 40. I will either ask the patient if they've worn it before. Sometimes a 30 to 40 in a circular knit doesn't seem too bad for them, but if you put them in a 30 to 40 in a flat knit, they'll really see the difference. So it's something you can work up to, or if they've already tolerated it, then a 30 to 40. I've tried 30 to 40 myself in a compression sock. I couldn't tolerate it.
Oh, okay, so
20 to 30 is okay.
I can relate. I had a 30 to 40 on my arm sleeve when I was probably in that first year after
Oh, yeah.
diagnosis. Would you mind, though, to maybe break down for someone who doesn't understand those measurements that you've just been speaking of? Could you maybe just highlight exactly what that measurement is? That
Sure.
15 to 20 is a bit ambiguous for some people who are maybe new to being early diagnosed.
Sure. So it's strengths, and it's mmHg you'll see on a lot of the packaging, which is milligrams of mercury. So you could walk into any drugstore, home healthcare store, and purchase a 15 to 20 or lower, an 8 to 15. Some socks have that, and you wouldn't need a prescription. Very light compression. They'll feel the compression. They'll know it's a compression sock, but anything higher, 20 to 30, you'll need a prescription for, because it is considered a medical device, and then you'd want a prescription for reasons, for patient history of their health, and make sure that they can wear something higher.
And maybe to note as well for our viewers that if you're buying something that's at the dollar store perhaps, or one of those other lower end stores, if there's no measurement on the garment, chances are there's probably not a lot of compression in that garment.
Exactly.
Do you agree?
Okay. Picking up on something you just said in answer to Deborah's that question there, you mentioned that to make sure they can tolerate it. And I know for people who have lymphedema in their lower extremities, they will do an ABI test. Can you explain some of the other things you might have to check before you get into a garment and the compression level?
Sure. Basically, well, we always go by what the clinician says, but you want to check their skin. If it's really fragile, you don't want anything too high. If they're diabetic, there may be some neuropathy in the limb, and you don't want them in anything higher. I wouldn't do a 30 to 40 for a diabetic. Other than that, a low compression, it still works really well. What I like to do is, if they've never worn the compression before, they're not used to it, just kind of work them up to a higher compression. Don't put them in anything too high. They're not gonna wear the garment. And you don't want to discourage people from their first garment to be too strong, and that's how they base it on, and they don't want to wear it.
So what is the number one thing you wished more lymphedema patients understood when it comes to garment use and understanding compression garments in a whole?
I think the biggest thing is compliance. So if they understand why they have to wear it every day, kind of give them an idea how the body works, how the lymph system with compression, can push the fluids out of the limb. You just kind of have to give them a background, an education on how the lymph system works and how the garment works when it's on. The way the muscle pumps as they're moving around every day, and it's being compressed at the same time, it's pushing fluids up. They may say it hurts to walk if they've got lymphedema in their legs, but in the long run, if they are walking with the compression garment on, every step they take, and as their muscles contracting, it's pushing up the leg. So that helps them to understand why they have to wear it. Skincare, always checking the skin, making sure it's well moisturized, clean, and every day. And then nutrition and exercise, I think, is the biggest thing.
Okay. I know one of the things that I've noticed with a lot of people that we've spoken to and that I've spoken to personally, they've never seen that chart that shows the lymphatics from the front and the back. And I think that's a really good gift to someone who's just been diagnosed, for them to actually understand visually where the lymphatics actually run.
Exactly.
They get told, but they don't necessarily, they need that visual stimulant, and you can't see through your skin. So
Exactly. Yeah, education is big. And you want the patients to know everything, like from the manual lymph drainage, taking care of the skin, all the steps to keeping the limb as small as possible and wearing the garment.
Now, can you show us and share the names of any lower extremity, upper extremity, head and neck garments that you think patients are really finding effective? Or
Sure. Yeah, I have some here. So basically this is an elastic sock. You can see it's very stretchy. So this would be for someone that has like a 0, maybe 1 stage lymphedema. You don't want it to be on a limb that's too swollen. It's just going to stretch out and like strangle the leg or the arm. It's okay for very mild, but I wouldn't say anything higher than that. But compression socks are great.
I just saw those. Can you show us the silicone beads? Because some people haven't seen those before.
Oh, sure.
Yeah.
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 So there's the silicone around the top. Oh, there we go. Keeps the sock in place. It's awesome. They're on arm sleeves as well.
Yes.
I always like putting that option on the custom garments as well. This is a custom flat knit arm sleeve. Same thing. You see the beads in there? Hard to see on the beige, but same idea. It's a flat knit, so it's going to contain the swelling, acts like a barrier. It's not going to let you swell. It's going to push the fluids back up the arm where they're supposed to go. Always to be worn with a gauntlet or a glove so that it's not pushing the fluids back down the arm.
Okay, I just want to say one thing for people who may not have had stockings yet or a garment. The circular knit is kind of, if you think of like an opaque pantyhose stocking.
Yes.
And the flat knit's almost like a really thin jersey knit sweater. The like without the fuzz, of course. Really a heavier texture than a stocking or a pantyhose.
Yeah. So this is a compression wrap with Velcro. It's the inelastic. So you can see the Velcro. It's like mimics the bandaging. Very safe. I like this for patients to start off with because it will help decrease, and because it's adjustable, so they can change the size of it. As they decrease, they can just make it tighter. It can also be worn at night. That's why I like this as well. They have arm sleeves in the wrap as well.
Yeah.
and I have a number of patients who've used that who couldn't tolerate bandaging in the phase, and that's a great way to get to go down. Especially when they're older or their hands don't work really well, it's much easier than bandaging. If you're
exactly.
Home, people have trouble with that. That's a great option.
And when I first see a patient for the first time and they want to get into a garment right away, this is perfect because it's going to help decrease before you put them in a custom flat knit. So It's a really good option. Also a gauntlet to wrap that goes with that. The last thing I have is the vest. So there's a lot of options you can do on the vests. They are custom seamed. I don't know if you can see it. So there's the neckline, zipper at the front, and there's like a little latch closure. So a lot of people wearing this, maybe they've had breast cancer, they may have scarring and hard for them to pull on different items, but this, because it's got the zipper at the front, really easy to get on and off. It can be sleeveless. This one has a little bit of a sleeve on it if they've had some swelling up here. Also, it's custom where you can have it to the waist or up higher, like more of a bra. But these are great, totally customizable. Neckline you can dip to a certain amount. But these are great. I have a lot of patients in the vest. It's custom seamed.
Awesome. Okay, you mentioned the word custom and over the counter, and we didn't really get into that. So can we just talk briefly about, again, how you would decide somebody needs a custom versus an over the counter or off the shelf item, just to make sure people are clear about that.
Sure. So depending on the swelling, again, I would say if their arm or leg isn't of a standard size, like bigger on the top, smaller on the bottom, I would go into custom. You want something that's going to be comfortable for the patient, so you would customize it. There's a lot of people that have a bigger bicep area, so you can go bigger in that area, smaller in the wrist, depending on where the swelling is and where they need the compression most. Same with the legs and the swelling. Like, you'd want most people with lymphedema in a flat knit to control the swelling. You can do the custom circular knit as well. But I wouldn't suggest it for someone that has a lot of swelling.
And the other benefit as a person who wears garments every single day of the custom is that you can put awesome things like I have extras in it. I have 2 kidney beans on either side of my ankles. That's where my fluid.
Oh, those are great.
So those kind of things, pockets to put foam in. So there are lots of things you can do with a flat and that you can't do with a circular, even though people tend to want circular because it's lighter and less.
Exactly.
Tight.
And those little dotted beads that hold arms in place and legs, you can put them in like the waist high custom garments. You can put them on the legs along the side to help grip. So they're helping grip the limb. You could do the zippers, you could do those pads in the ankle, you could do a comfort zone in the elbow. Same with the knee area. Depending on the swelling, you don't want to do too much in that area in case the swelling pools in that area, but most people, they should be okay with it. But yeah, lots of great options on the custom garments.
Is there anything else that you would like to share that we've maybe missed regarding the many different types of compression garments before we jump off and finish this call?
No, I would just say find a qualified fitter. They see a lot. They know a lot about garments. The clinicians, the therapists, the authorizers, they know a lot, and we all work hand in hand together for the best patient outcomes. So find a reputable fitter and therapist, and also, like you say, don't go to the dollar store or purchase anything online. You don't know what you're getting.
Yeah,
and there's not a lot of us around, like lymphedema therapists. We need more.
and more fitters too, because I think Toronto, big cities in Canada, definitely I think there's a fair number of us, but smaller outlying areas, and I think in the States, probably sometimes there's only one person who does that thing and for miles and miles and miles. So
yes,
that all comes into account as to what people can get and find for themselves.
Absolutely.
I agree. Yeah.
So, right.
Thank you so much, Maria.
Thank you, ladies.
Knowledge.
It was great. I really enjoyed it.
Thank you so much.